Hi, everyone. Dr. Linda Matteoli here from Origins Incubator, where I help physicians start and grow their dream practice. So today I want to talk about how to conduct an effective discovery call, which will turn that prospective patient into a patient. This phone call is extremely important. Number one, because no one can talk about the practice that you've created, talk about your philosophy with treating patients or anything like you can. So especially when you're first starting out, all avenues, all lead flows from emails, websites, whatever, however it is you're marketing, needs to go right to this option for a discovery call. If you have somebody answering your phones in the beginning, they can kind of answer some initial questions, but then they really need to be encouraging the person on the other line to talk to you. If you're available, if you're not that busy and you're available right then, talk to them right then. Like, really decrease that time from when the patient is calling and asking questions to speaking with you. So when you don't have a lot of um, patients appointments in the beginning, like, open up your schedule for all the discovery calls. In the beginning, when I first started, I would do discovery calls before I went into work. So from like 7 to 8 in the morning, I would have evening opportunities. I left I left the weekends free, but I had that availability for about a year as I was trying to grow from like 0 to 100 patients. If I was in the office and my manager answered the phone and they were asking questions, I'd be like, oh, I'll take it. I'll talk to them right now. So that's number one, create availability, and you're trying to get them to the discovery call immediately. Okay, so now that you have them, how do we conduct it that appropriately conveys the uniqueness and value of your practice, in a way that is really holding space and honoring the patient at the same time? So if you haven't listened to my creating value video, go ahead and listen to that, because that's a good video too. That kind of gets into that piece of it a little bit more in depth. So you're on the phone with somebody. Most of the time, these are on the phone. So we're going to pretend that. First of all, start with positivity. So I always say, if the person's name is Jane, I don't know, say, "Hi, Jane. It's wonderful to speak with you today." So start with that, like, upbeat positivity. So, "Hi, Jane. It's wonderful to speak today." And I launch right into what I expect, or to give them some sort of framework. So, "It's wonderful to speak with you today. What I like to do for these calls is I'd like to hear about what you're experiencing, what your symptoms are, what has worked and hasn't worked in the past, and your ultimate goal. What are you trying to achieve?" So it's those three things, like, what are you currently experiencing? What have you done in the past? And what are you trying to achieve? So those three things I want to know right away. And oftentimes I would kind of jot those down. And if I'm not very clear, I'll kind of revisit and go back to it. So I'm just going to say, so go ahead, take your time. I'm going to be taking notes, and I want to hear from you. So you start with positivity, and then you give them structure. Structure makes people feel safe, and then they also feel like, you're in control of the situation, and it gives them a sense of what to expect from you in the future. Okay, and then you listen to their story. So what I oftentimes do, so they're going to just give paragraphs and paragraphs. Number one, I listen for the feeling words. So, and I connect with that. So it's like those active listening skills. So I would say, like, "Oh, I can see how that would make you feel sad," or, "I can see how that would be very difficult." Like, just kind of, just to let them know that you're listening. And every single conversation, once they're kind of done with their, like, paragraph and what they're saying, I always say, "So what I'm hearing is," or, "I just want to make sure I understand this." I repeat it back to them. And it's not, I mean, you don't use paragraphs like they used for you. You're just kind of really, like, condensing it down. Okay, so what I'm hearing is you're concerned about your thyroid, and you've been told your thyroid tests are normal, but you think that there might be something else going on. You don't feel like yourself. You're tired all the time. You can't lose weight. And so you want to kind of get to the bottom of this. Is that right? And if they're like, yes, um, so now you know. And then you reconnect. So now you've kind of like restated what they're going through. So you understand it, right? So that's important for you. Um, and then you kind of reconnect to the outcome that they're trying to achieve. So okay, so what is your ultimate goal here? Like if I had a magic wand, so that's what I say after I repeat it to them, I say, if I had a magic wand, what would I accomplish? Sometimes what their magic wand scenario is something like completely different that I thought that they were going to say. So I always ask that because then if you go right into discussing how you would approach their case, but it's for a goal that you've created for them, it's not really their goal, then there's going to be a total disconnect there. So you need to like do for them what they want. So if okay, so what I'm understanding is that your main goal is your fatigue. It sounds like you just feel tired, you can't keep up with the demands of family and work, and and that's your primary goal. So make them say their dream outcome and say the magic wand piece. Like if anything's possible, what would it be? Okay. So once you have that, um, you know if you're the person for them. So if they say, like, okay, I've tried this in the past. So say they say, I saw a doctor and we did a low inflammatory diet, we did a gut rehabilitation, and nervous system support, and it just didn't work for me or whatever. If that is your approach, if that is your core approach, tell them that. Say, that's how I approach care, and I'd love to hear more about like what tests they did maybe. But that's where I would have started with you as well. And that's a good opportunity to kind of usher them into the foundational assessment, which is the second appointment that I recommend, which is a no long-term commitment, just a one-time deep dive with blood work. But that would be an opportunity where I would say, how about this? Next step, like let's do the foundational assessment. We'll get some recent blood work to see what's going on now. Bring your tests from your previous doctor. I'll look through them and we'll decide if my membership, if my approach differs enough to kind of make a difference for you. So that's a way to really utilize that foundational assessment appointment. That's super helpful. The second scenario that can be difficult is if they need approach that you just don't offer. So say they were recently diagnosed with breast cancer or something, and you're not an integrative oncologist. Like that's not what you do. So you just make it very clear, like, okay, that I don't think I'm the person for you because A, B, and C. Like let me refer you. This is a great person that can work with you. Um, so always be upfront, honest about your skills, about what you can do. So if you feel like, oh, I can really help this person, like this is my person, this is like the person I had in mind when I was like developing my practice after, then talk to them about how working with you can increase their perceived outcome of success, decrease the time, and decrease the pain. So that's that value equation that's in my other video. But no, actually, I have it right here. So value is dream outcome times perceived likelihood of achievement. So we want to increase the numerator, decrease the denominator, which is time, delay, and effort and sacrifice. So you can say, the how I would approach your case is. So that's how I always lead into that. Like these lead-in sentences are super important so you flow. So if I had a magic wand, so it's wonderful to speak with you. This is what I'd like from you out of this call, like those three things that you want them to say. Repeat it back to them. If I had a magic wand, what would we achieve? And then, okay, how I would approach your case is. And then you go into the foundational assessment. So the next step is the foundational assessment, where it's a 90-minute appointment where I review your life from birth. So I really need to know, like, as a human being, what you have been through to kind of bring us to this point. We do blood work at that time. And then I can really assess what you might need. So if we're concerned about thyroid, there's a lot of different factors that could be contributing to that. It could be nutrition, it could be adrenals, it could be autoimmunity. And so I need to kind of know which direction to go in. And after our foundational assessment, when I've done my physical exam, when I have some recent blood work, and when I just learn more about you, then I know what steps we need to take from there. So then I say, if then you ask if there's any questions, you clarify that, and then you say, okay, would you like to move forward with this today? Or another way of wording it is there any reason why we can't move forward with the foundational assessment today? And then have everything ready. Like, you can say, I'm ready to accept payment now, and we can go ahead and get you onboarded and rolling right now. Or if they want to think about it, you can send them the link. But that's how I transition. Like, how I would approach your case is then go into how you do the foundational assessment, how you use that appointment to get more information to recommend the advanced testing that you would use to treat them throughout the year-long membership. And then that's how you close it. Like, okay, ready to move forward, and then you just go from there. So if you say you're going to email them or get back to them with the link or whatever, do it right away. Make everything as like fluid and decreased time as possible, and practice these. Like, if you're listening to this and you're in the incubator now, we can role play these, because the more you get used to talking about your practice, you are used to kind of connecting with their story and really conveying the value of your practice that you've worked so hard to create. Then it just kind of, you're just talking about it, and you have a very clear flow for this person to just follow. So I hope that was helpful. Reach out with any questions or concerns, and I'll see you soon.